The kidneys are one of the only sets of paired organs within the abdominal region. As we can see here, the kidneys are bilaterally located, and this is the case in vertebrates, where we have one on both the right and the left sides in healthy individuals. As we can see, the kidneys are positioned quite far posteriorly within the abdominal cavity, and they're positioned at a slight angle. The kidneys are predominantly going to be protected by fat and soft tissue structures. They're considered retroperitoneal as they are lying behind or posterior to the peritoneal lining within the abdominal cavity. From a posterior perspective, we can see that the kidneys are going to be slightly protected superiorly by the floating ribs, ribs 11 and 12. Now, the kidneys are going to be lying posteriorly against some of the muscles within the posterior abdominal wall, but surrounded by protective layers of fat. As we can see, the actual shape of the kidney is somewhat C-shaped, with a concave side facing medially and a convex side facing laterally. The right kidney is typically going to be positioned slightly lower or more inferior than the left kidney. And the reason for this is due to the presence of the large internal abdominal organ of the liver. The liver is the largest internal organ of our body, and it is going to be positioned in such a way that it pushes down the right kidney on this side of the abdomen. Now, the left kidney is going to be in close proximity to the spleen. However, the spleen is a much smaller organ than the liver in a healthy individual, and thus does not displace the kidney on the left side as much. If we were to take a look at the actual organizational structure of the kidney, we'll see that it is made up of different layers. The outermost layer is a tough fibrous lining known as the renal capsule, and this is going to surround the outermost aspect of the kidney. In cross-section, we would see this represented as a thin line going completely around the periphery of the renal tissue. Deep to the capsule, we're going to get the next layer, known as the renal cortex. Now, the renal cortex is just deep to the capsule, but it's also going to have extensions that come down into the kidney itself, known as renal columns. So these are extensions of the cortical tissue from the renal cortex. The deepest layer is the renal medulla. Now, the medullary tissue is going to be organized into cone-shaped or pyramidal-shaped component pieces known as lobules. And these renal pyramids are going to be a major component of each lobule or lobe of the kidney. So we're going to have cortical tissue as well as medullary tissue that will be organized in typically somewhere between 8 and 18 of these cone-shaped lobules or renal lobes. At the tip of each of these pyramids, we're going to see the beginnings of the collecting system of the kidney. Now, the collecting system is where the filtrated urine and the waste products are going to be put to then drain out of the kidney. And we can see that the collecting system is going to be still located within the kidney itself. And this is going to be within a fat-filled pocket known as the renal sinus. And within the renal sinus, we're also going to have the branches of the renal vessels. The renal artery is going to bring blood into the kidney in these spaces of the renal sinuses. The veins are going to return blood from the renal tissue back out towards the inferior vena cava. And the collecting system is going to coalesce or funnel together towards the collecting system towards the ureter. Now, this is going to pass through an opening on the medial aspect of the kidney known as the renal hilum, which you can think of essentially as the doorway in and out of the kidney.